Hi, and welcome to this presentation in which we're going to unpack the issue of selection bias. So what are we going to talk about? We're going to talk about what is selection bias, how does it impact a study, and what are the sources. So before delving into selection bias, it's useful to think about the populations. And I've got this diagram here, which is one of the ways in which we can conceptualize them. It's not the only way, and I think it's important to note that there can be some differences in the terminology. And what's really more important than, getting all the terms right is understanding what they mean. And so let's tease this apart. If we start with the widest oval shape here, and that is our target population, and that's who we wish to extrapolate our results to. Okay, and that could be different between you and I. So we might both read a study on mastitis in dairy cows. You may conclude that the study results are applicable in the New Zealand situation, and I may, for equally legitimate reasons, conclude otherwise. So there is no clear cut, this is the target population. And the other thing about a target population is that there can be more than one. So if we drill down, we then come to the source population, and that's essentially who we want to sample from. So let's imagine we wanted to collect data on dairy farms within New Zealand. Our source population would be all dairy farms in New Zealand. Ideally, we would be able to define that source population in terms of time. So we would say what day or time period are we talking about sampling, and we would also be able to provide a geographical area for the source population, in this case New Zealand, and preferably we would also be able to say how many farms in the population. That's not always possible. So from that source population, we are going to decide who is eligible. Now, sometimes we don't have any eligibility requirements, so the source population and the eligible population are exactly the same. But taking this dairy cow example, dairy farm example, let's say that we decide to locate and select farms that are only in the North Island of New Zealand. Then our eligible population are dairy farms on the North Island, and we may even put other criteria, which is they have to have at least 100 animals. From there, from our eligible population, we're not going to necessarily select everyone, so we're going to have a study population that we invite to participate, and we could potentially drill down even further and have our study participants, because not everyone agrees to participate. So if we go back out, we have the study population is who we invite to participate. The eligible population is who is eligible to participate in the study. The source population is where have we drawn the study population from, and ideally we will be able to say how many were in the source population. That's not always possible, but we should be able to describe it in time and in place. And then once we've got those results, people will read them and decide for themselves who do they want to extrapolate to, so who is their target population. Alright, so if we now move on to consider what is selection bias, because it's going to be an issue that crops up in virtually every study, and that is because we have different ways of sampling, and then we also have differences in who eventually participates in our study. So if we did unbiased sampling and we had 100% follow-up, then our 2x2 table would look exactly the same, in so much as, if 10% of the population were going to be diseased and exposed, if we've done our sampling right, then 10% of the study population will be diseased and exposed, and so forth. However, when there is biased sampling, or people agree to participate or don't agree to participate, then what ends up happening is there gets to be a distortion. So what we may find is that those who are exposed to our factor of interest and have disease might be more likely to respond. So we end up with a incorrect measure of effect simply because this cell in our 2x2 table was overrepresented. Okay, and so that can happen because of how we sample. It can happen because of who agrees to participate. Now, the problem we have is we never really know what the truth is. So we can't know for sure that selection bias occurred. We can only report on how we sampled and how people agreed or didn't agree to participate. So that's a little bit of an issue with selection bias, is we can't be sure it was there. We infer it. So what is the impact of selection bias? And I want to give you two concepts, and the first is internal validity and the second is external validity. So let's start with internal validity. And it's a measure of how confident can we be that the difference between the groups can be attributed to the impact of the exposure or the intervention on the outcome. And so if we think about our laboratory studies with mice, we give them a really controlled environment. We might only alter one thing, the diet, or they might be gene knockout mice. And so we have such tight control in that environment, we're pretty confident that the difference is due between between what we did to the mouse and what we observed happened. Okay, so those studies have really high internal validity. Okay, so we believe that the results are correct for the study participants. We then need to make a decision as to how externally valid are they. So in other words, could we apply the results that we saw in our laboratory mice to other mice? Or to an entirely different population. So could we apply the results that we did in this very detailed study on cancer in mice to what might happen in people or what might happen in dogs? And that's always the big unknown. But what we really need to be clear on, though, is before we even think about who can I apply these results to, I have to be fairly confident that the results have a high internal validity. That is, I believe that the selection and participation was such that the results have minimal bias. I believe that measurement was good, and I believe confounding has been dealt with. And unless I'm sort of comfortable that the evidence is of a reasonable quality, I shouldn't even be considering extrapolation. Now, for those of you who are on Twitter and like a bit of sort of nerdy science, there's a great Twitter account called Just Says in Mice, which takes apart top headlines from a range of newspapers and when they are reporting findings, and actually the original study was just in mice, so it's a bit of a laugh there. All right, so it's really important often with selection bias, what people will do is they'll say, but how alike were the study population to the target population, or how alike was the study population to the source population? And we might make comments like, well, you know, it wasn't a representative sample. Now, a really important thing is that it is not essential that if 10% of your population were dairy heifers, that 10% of your study population are dairy heifers. There is no requirement that they are identical populations. That's first and foremost. And then the other component that we need to think about is we often sort of will say, well, say for example, we are looking at how an opioid worked, and the study was done in animals undergoing orthopedic surgery in the UK, and we're wanting to apply them to New Zealand. Now, the question is not how alike are New Zealand dogs undergoing orthopedic surgery to British dogs undergoing orthopedic surgery and getting morphine. Rather, it's would we expect the response to vary? Would we expect that the fundamentals of the process would be different between UK dogs undergoing orthopedics and New Zealand dogs undergoing orthopedics? And if your answer to that is, well, no, it's a biological process, we don't expect it to be different, then we could infer that the results can be applied. Now, often people say, well, what about confounders? And we're going to talk more about them in a little bit. But it's really important to realize that when you control for confounding, which we will talk about how to do, then what you actually are left with is an unbiased estimate. So that estimate is adjusted for confounding. And so the question is, do we think the response is going to be similar? And if it is, and we have a controlled for confounding, we can take that as what we would expect to find in our own population. All right, so sources of selection bias. And so this is another way to think about populations, and we have our target population, and that's, so again, you can see here this is taken from another textbook and it's using slightly different language. And so we might have losses due to how we sampled and sampling restrictions. We lose due to ineligibility or non-response, and then we can lose people due to attrition. And so let's walk through these steps. So one of the sources is not using probability sampling, or random sampling is one example of that. And it's often an issue because in order to randomly sample, we need to actually know who everyone is that we can sample from. And we call that list of people or animals a sampling frame, and actually getting a sampling frame is really hard. For example, if we wanted to collect information on animals on a lifestyle block, we have no knowledge of where those small-scale hobby farms or lifestyle blocks exist in New Zealand, or in most countries actually. There's no registry of working dogs in New Zealand. Certainly dogs are required and supposed to be registered, but there isn't 100% compliance, and due to privacy rules we're not able to access the underlying information. Another one, for example, might be if you wanted to know about backyard poultry, or in some communities the keeping of backyard pigs. We would have no idea who has them or doesn't, so we couldn't sample randomly. And the most common effect of this is on our external validity, and that is, can we apply back to other populations or to the wider population we selected from? Another problem that comes up is patients presenting to a hospital or specialists are likely to have a particular exposure than patients diagnosed elsewhere. It's particularly an issue with a case control study, especially when our cases are from the referral hospital. They may not be representative of the normal pattern of exposure and also the severity of cases. And often what we do is we draw our controls from those in the hospital rather than more generally. And I want to give you two examples of the issues, and they come from human medicine. And the first is around coffee and cancer. And so a case control study was done which found cancer increased the risk of stomach cancer. Coffee increased the risk of stomach cancer. And the way they got the cases, they got those who were from a gastroenterologist, and then they asked the gastroenterologist to supply them with a control group who had been selected from their gastroenterologist list. And what they found was that those who had cancer were more likely to have higher levels of caffeine consumption. Whenever this study has been repeated, using different controls or a totally different design, they haven't been able to replicate it. And part of the reason is that if you think about the conditions for which people go to a gastroenterologist, they often are asked to consume less coffee to help with that, or they've chosen to consume less coffee. So what was actually happening was those with stomach cancer had just normal population levels of caffeine use, whereas the control group was abnormally low. And so the whole difference that was observed was down to selection. So that's something to watch for in a case control study. Have they selected from a group that visited the hospital? And the way they got around this issue in human health is a really interesting study where they looked at hip fractures in women over 65. They got hip fractures and they had a very defined geographical area. You had to have live in a particular set of postcodes. And then what they did was they went round and they door knocked to recruit controls. So they would select a street, and that would be the street that they would try and recruit controls from. And the reason the cake is there is, talking to the researcher who did this, that one time they showed up and this woman was, "Thank God you've come, because I've been baking a cake for every day for when you arrived." And so, it's just one of those stories you remember. But, the key is if you're selecting cases and controls, the controls must arise from the same population that gave rise to your cases. So in other words, another way to think about it is, if those controls were cases, would you have detected them? Okay, so would they have come to the hospital? And so in the veterinary medicine, I would say it's probably reasonable to select in small animal medicine from your client database, but you shouldn't be limiting that to animals that you have seen this week or are in the hospital. It would be better to search more widely. Okay, so there's something else to bear in mind, is that when we go to the veterinarians, that we often see quite different patterns of disease. And this was shown when asking what racetrack owners did about diagnosing lameness, and only 8% of cases of shin soreness were seen by veterinarian, whereas 100% of fracture cases were. So it just gives you an idea of the difference between what happens in the clinic and what happens outside. Another issue is, of course, non-response. And that's because those people that choose to participate in studies may have different patterns of exposure. And this is always going to be a problem in epidemiology studies, whether we're talking about humans medicine or veterinary medicine, because people have to decide whether to participate. So, you consider, if you're doing a phone survey, there are silent numbers, and we know for a fact that people with silent numbers are different to those without. Also, if you're just ringing up and you ring up at one point in time, you're going to get a certain type of person. So if you rang up at 4 o'clock in the afternoon, you would have different people at home and answering than if you rang at 8 o'clock at night, for example. And one of the ways that we can't remove it, but it can be useful to explore, and this comes from my PhD, where we compared those that were enrolled or those that were removed from the study early for poor compliance or chose not to participate. So we had some key values that we could measure, and we just compared them. Another source of problem is attrition bias or survivorship bias, and that's when individuals in a cohort or a trial are lost to follow-up. So anything where there is a follow-up has the opportunity that you wouldn't be able to follow them. And so in veterinary medicine, particularly production medicine, we have the issue of culling. Another thing that can happen when we do longitudinal data is that we can have this kind of patchy data, so data could be missing at various time points. So just some examples again from my PhD. This is sort of a standard way of presenting data, and it's kind of showing that if we look across here, about 50% of the animals in a longitudinal study looking at injuries in racehorses were followed for about 15 months. Okay, and so 50% was studied for less than 15 months and 50% for more than. Also, in terms of not controlling for but explaining where bias comes in, it's useful to explain, where did you lose things for follow-up, why were they lost to follow-up, and this is again a table from my PhD in which we were looking at injuries in thoroughbred racehorses. And I said to you that sometimes data can be patchy, it can be missing, or it can be incorrect, and that can be problematic. And again, from my PhD, we were looking at injuries in racehorses. And so what we measured was, by the different trainers in the study, what was their rate of missing and incorrect data. So when we could compare to a race records, was the race record the trainer gave me the same as what was listed officially? That was how we decided if it was incorrect. And you can see that there's huge variability across our trainers in the quality of data, and so it is possible that some trainer differences we observed could simply be that they varied in data quality. So in summarizing these things, we